right, today I'm here with Nicole, our Director of Healthcare Services. I'm Michelle, the Executive Director at Miller's Grant, and we get the pleasure of learning a little bit more about you today for all of our viewers.
Thank you for having me.
So how about you kick us off? Just tell us a little bit about yourself, anything that you want to share, where you were born, how long you lived in Maryland.
So I was born and raised in Maryland. I'm from Reisterstown, Maryland, and I am currently a resident now in Ellicott City, and I come from a big family. I have 5 brothers. I enjoy hiking outside, working out, and
Yeah, it's nice being super close to home, right, when you commute? What is your commute like?
Now it's about 7 minutes. Before I sat in traffic for about 45 minutes.
Every day to get here?
Yeah, every day.
I see, you really like coming to the commute. You drive 45 minutes in traffic. And how many brothers did you say you have?
5.
How's it being the only girl?
I liked it. I think they toughened me up and actually set me up for success in my job currently. It's a lot tougher now because they didn't let me get away with a lot.
Where do you fall in the 6?
I am the second youngest.
Okay.
I have a little brother, so I get to experience the best of both worlds. Being the youngest and the oldest.
Yeah, one of 6. That's and your family's super close knit.
Yeah, super close. Everyone's local except for one. So.
Okay. Any nieces, nephews?
Yeah, I have 3 nieces, 2 nephews, and 1 on the way, and 1 nephew on the way.
Oh, family's growing.
Growing, yeah.
Awesome. So you mentioned you like to work out when you're not at work. What do you do for a workout?
I am I'm dedicated to the gym, so I go to the gym every day, but as the weather starts to get nice, I like to go out and go hiking.
Okay, so you're at the gym. Do you do strength training, cardio, all of the above?
All of it, but I'm big into strength training.
Okay. Have you made that decision on purchasing that Peloton yet?
Not yet. I'm getting there.
I'm going to get her there. Good. So what motivates you, whether it's here or outside stuff you've been through, your schooling, you've been through getting your AIT, which we'll talk about. What motivates you? What drives you?
I think just successes drive me. So I'm very motivated just to grow and develop as not only a person, but also professionally. So it's always motivating me to do better.
Okay, good. And then you mentioned you went to private school for high school. Yep. Where'd you go to high school?
I went to Gristol Academy.
Okay, and then, that's right. And then after Gristol, you went where?
James Madison.
All right, and then Nicole is a little shy, but where'd you get your master's? You just finished this winter.
Yeah, I graduated in December. I went to University of Central Florida.
And you're officially done.
I am done, yeah. So
All
I have a master's.
That's awesome. Yeah. Did you find that, what was more challenging, your master's or obtaining your nursing home administrator license?
I actually think my nursing home administrator license, because my master's I had to learn to balance my time, and I had a pretty strict schedule, whereas my AIT there's a lot more free time, so I had to really sit down and dedicate my time on the weekends to studying.
More like self-paced.
Yeah.
Good. So tell our viewers, because I know not everybody knows what an administrator training is. So walk us through Maryland. What do you have to do to become a licensed administrator?
So you have to go through a program called an administrator in training. It's pretty strenuous in Maryland. If not, I think it may be the strictest in the United States. So I had to go through a 12-month training process. So I had to work in every discipline. So I had to do facilities, housekeeping, dining, nursing. And I just spent time with each of them. I had to work every shift and study all the regulations and sit for boards. So I had to take state and federal boards as well.
It was fun, wasn't it?
All while being unpaid.
Yeah, it's typically an unpaid internship. What was your most challenging part of the AIT, would you say? Like, where'd you learn the most about yourself? Which department?
I think the one I learned most about myself, definitely social work.
Okay.
That was hard. It was difficult because you saw a different side of the staff, the families, and the residents. You can go into nursing; it's pretty straightforward, but you deal with a lot of different issues when it comes to social work. And during my AT, I actually was in social work rotation during my grandfather being at the facility, so it was really eye-opening to see how social workers approach it.
Okay. Did you always know you wanted to be an administrator? Walk us through, how did you decide one day, hey, I want to be in healthcare?
So I always knew I wanted to go into something in healthcare. I thought nursing was the path for me, and then I realized blood is not the path for me. And then I started volunteering in college at Sunnyside Retirement Community in Harrisonburg, and then came and volunteered at Edenwald during college during breaks, and that's when I really gained a passion for administrator.
That was another just volunteer internship.
Yeah.
Another good.
Yeah, but I spent a lot of time in nursing, in the assisted living and nursing homes with my grandparents. So that's where I started my passion.
Good. Anybody in your family in healthcare?
My mom's a nurse.
Okay.
Yep.
So always had that.
Yeah.
Good. So far, what would you say one of your biggest accomplishes in your career as a healthcare administrator? So obviously getting your master's and becoming a licensed nursing home administrator, but what are you most proud of?
So about 6 months into becoming a full-time administrator, COVID hit. So running a facility in the peak of COVID was difficult, but it really helped me gain my confidence. I was able to make decisions and lead our team. And I had a really strong team and support system, but we didn't actually have at my other facility one positive case during the peak for an entire year.
Yeah, you were at a subacute facility, right?
Yeah.
Good. Yeah, COVID was hard. I mean, remember the days of testing twice a week, staff visitation, no visitors for, gosh, months and months. Yeah, well, that definitely, literally is the definition of jumping into the deep end of becoming to an administrator. So you're coming up on your 2-year anniversary at Miller's Grant, well, end of May, right? So tell me through, what has been your favorite part about working at Miller's Grant so far?
My favorite part's been our interdisciplinary team. I love coming to work. I mean, our team is so strong. I love that I can come to work and they do make my day. You know, you always say that we spend more time here than with our family, and I really do feel like a family here. And I know that anyone on the team is willing to step in and help.
No, absolutely, yeah, and all the way up to the same goal to you know, serve, and you know, like we say, it's definitely, you know, what is your why, right? So that's what you have to do. Good. Well, I know we're growing. Obviously, we'll have eventually construction coming, and you know, adding a memory unit, private rooms, more hospitality. What are you most looking forward to about the construction?
I'm really excited to see what new technologies and innovations come from the construction. I think there's such a big stigma when it comes to aging adults, nursing homes, assisted livings, and I think this new construction can show the strides that we have actually made in the industry, and I think that's so important for the community to see, for the residents to see, to show that there doesn't need to be a stigma. Yeah,
especially now with such a hospitality type approach with serving older adults. And construction's easy, right? Like it's definitely not going to be challenging at all, but I always say worth it. You know, you always kind of live in the state of construction to constantly upgrade and improve services. Good, and the team's looking forward to the process and the construction as well. Good. So fast forward a few years, kind of kick us off with the last question. Where do you see yourself? What is your next, you know, move you think in your career?
My next move in a few years, I'd love to step into an executive director role. So, you know, I'm getting a taste of a good mentor, so I'm excited to see what the future brings. And hopefully that's what the future holds.
Well, we're so happy that you joined us at Miller's Grant. I know our paths had crossed before, and you do a great job with the team and residents. So we definitely look forward to many more years of success here.
Thank you.
Awesome. Thanks for joining us today.